testimony you may give in the cause now pending before this court shall be the truth, the whole truth, and nothing but the truth, so help you God.
I do.
You may be seated. Please state your name for the record. Spell your first and last names.
Christopher Rodgers, Christopher Roggers.
Dr. Rodgers, good morning.
Good morning.
Let me provide you with some instructions that I give to every witness in every case. The first, please sit back and relax. The second, please speak loudly. Everybody's got to be able to hear you, so it would help if you spoke in a little louder voice. Thirdly, if you are called upon to provide a yes or no answer to a question, use those terms yes or no and avoid slang which can be a little tricky. And lastly, please wait until you hear an entire question before you even start to answer it. Many of us think we know what an answer is, so we start to interrupt the questioner. But in court, it's important to hear the whole question first and then respond. Is that acceptable?
Yes, thank you.
Direct. Mr. Walgren?
Good morning, Doctor.
Good morning.
Sir, what do you do for a living?
I'm a deputy medical examiner for Los Angeles County.
And what is a deputy medical examiner?
I do autopsies in coroner's cases and determine cause and mode of death based on the findings.
And how long have you been a deputy medical examiner?
Since 1988.
And your current position is what?
Chief of Forensic Medicine.
And doctor, can you describe for us what is forensic medicine?
Forensic medicine is the part of pathology that deals with coroner's cases, so in other words, dealing with sudden, violent, or unexplained death.
And prior to being employed at the LA County Coroner's Office as a deputy medical examiner, can you describe for us your educational background and training?
I attended medical school at the University of California, San Diego. I did pathology residency at Los Angeles County USC Medical Center. I trained in forensic pathology at Los Angeles County Coroner, and I'm board certified in forensic pathology.
Has your entire career been devoted to forensic pathology?
Yes.
And of course you are a medical doctor?
That's correct.
What is an autopsy, doctor?
An autopsy is an examination of the outside of a deceased person as well as each of the internal organs.
Describe for us in general terms then when you say the outside of a person. As a forensic medical examiner, what are you looking for in your conducting an autopsy on a given individual?
Well, I would be looking for any injuries that might be present or evidence of natural disease, or also any kind of identifying features like scars or tattoos.
Then all of this is in pursuit of determining the cause and manner of death?
That's correct.
Now, you also mentioned, in addition to the outside of the body, you conduct forensic analysis of the internal organs. What are you looking for there, generally speaking?
In the internal organs, I would be looking for any abnormality or disease in the organs themselves, and then I would also collect specimens for supplemental testing, such as toxicology or criminalistic testing.
All right. And how many autopsies would you say you've personally handled or been present for in your career?
I would say several thousand.
And did you conduct the autopsy on the decedent, in this case, Michael Joseph Jackson?
Yes.
And does your autopsy report bear a particular case number that identifies it as being the report and findings related to the decedent, in this case, Mr. Jackson?
Yes, it does.
Okay, is that number 2009-04415?
Yes.
When did you conduct that autopsy, Dr. Rodgers?
That was on June 26, 2009.
And going through the findings you made on June 26, 2009,